Greetings. This is the artist, Davina, aka Moment Lose, DvinaEstrella, artist, mother, wife, spiritualist, here again with my trusty raspberry leaf tea, to talk again about home birth and getting ready to bring the baby in. So as you can see, this is my bed, and I have two tables set up. Over there is a table, and it's very close to the bed, and over there is another table that will most likely go near the bathroom at some point, but I have young ones that like to mess with them, so I'm not going to put it over there right now because I don't want to have to keep saying stuff. So let's discuss what we have on this table over here. And please bear with me because I'm new to this video. So, what we've got over here on this table, very close to the bed, are baby diapers, extremely accessible, stacked up so that we can get to them without moving from the bed. Lanolin. This comes in much handy when you're nursing, because in the beginning of nursing, your nipples gonna get cracked and maybe blistering or whatever, and it helps a lot in my opinion. So I like to keep it close. It's like one of my best friends for nursing. Also, we've got a few blankets stacked up over here. If you can see, let's see. Got a lot of blankets stacked up over here. Baby socks. A couple of little baby t-shirts. All this is stacked up on this table because you don't want to have to get up. You don't want to have to set up this table after you have the baby. So it's good to really just have all this stuff ready beforehand. Some baby hats. More than one, because believe it or not, these little babies get messy fast. You will change clothes more times than you think you will have to. So I've got 3 little baby outfits ready. Like I said, multiple blankets, because even though I wash sheets and wash blankets before the baby comes, I still like to have just stuff for the baby, even inside the bed, because babies spit up, and you might have to change their blankets often. And so mothers that have birthed at home, or have had babies before, kind of know this, but I'm just saying it just FYI. Okay. So I like to have my bed, for instance, already made up, right? But I'll pull back the sheet and lay down an extra blanket just for the baby. Just for the babies to be on. Okay? Then I've got little baby towels because wipes are expensive, to be honest. And I just prefer the old school use a towel kind of thing with a little Tupperware or something. You could just keep a small Tupperware container with some warm water in it and a little bit of like baby soap or something like that, and just reuse that over and over and over and over again. The towels are washable. They don't cost a lot, so there solves that problem. I don't have the little Tupperware container over here right now because I can't find it, but that's okay. We'll find something. Then I got a ton of birth cloths because, like I said, the baby is going to get messy faster than you think and spit up, and because their little digestive systems are new, basically, and so we like to just keep these little things around really close. So I've got 4 of them right here, and let's see what else. So a lot of people say that you should wash up these things for the baby and put them in a plastic bag and don't open them until the baby comes. And you could do that. I mean, I'm sure it's worth doing. It's a safety precaution. I don't wrap them up in a plastic bag. I never have, and I've never had a problem, So it's really up to you what you choose to do. So we also got these little soft disposable towel type things. They're kind of like paper towels, and they're just good for spit up or changing diapers or whatever, you know what I mean? I just use a towel, or you just have them nearby just because. So what else? Let's go to this table over here. All right. And what I'm going to do is actually bring this table a little bit closer. Okay, so we've got the table just a little bit closer. Let's see what we got on this table. So, on this table, we got a lot of mommy diapers. These things are called chucks. And chucks are like those things that they have in the hospital where, they put them under the patient, or if you're nursing, have an elderly person or somebody, even a pregnant person at home that has maybe wets the bed, or in this case has just finished having a baby and might possibly bleed. So they have the chucks, and I don't want to open up this chuck, but this one came in my birth kit and it was kind of already unstuck, and so basically this is the chucks. Okay, and then this is what we do with the chucks. You put the plastic side down on the bed and put this soft part up so that it absorbs whatever moisture, basically. So that's what the Chucks do. So they're the mommy diapers, basically. And you might need a lot of those, depending on how much you bleed afterwards. I didn't bleed that much, and I think part of the reason was everybody's different, but I was drinking alfalfa tea before I had my baby last time, and I really recovered really quickly. Like, I only bled maybe 3 days, honestly, and it wasn't very heavy at all. I was up on my feet like very soon, and so yeah, I didn't need a lot of Chucks. I mean, I use a lot of them because I like to stay clean, and dry, but not really because I had a lot of bleeding. Okay, and so this thing right here is an umbilical cord clamp, and this is for when the baby comes out and the placenta has stopped pumping the nutrients and the oxygen in the blood to the baby, and you get ready to cut the cord, and you don't want possibly blood to splatter everywhere or whatever, I guess, when you cut the cord. I actually did not cut the cord last time. My husband cut the cord. I was too busy trying to go pee, which is another very important part of giving birth. You have to go pee. Make sure that you go pee. That's an important thing. But so I didn't use these things, and then I just heard in this woman's group that you need some type of umbilical cord release thing, clamp, to undo this. So you may or may not want to use this. I plan on using a sterilized shoestring to tie my baby's cord off. If I want to do that, I'm just gonna boil a shoestring, or I might just do the lotus birth, which I just heard about, which is letting the umbilical cord fall off naturally within 3 to 6 days. Might give me a lot of time to just get some rest. So pads. You could use a pad if you want to get up and go. They gave me one in my birth kit, one pad, right? You would probably need more than one pad, honestly. But they gave me one. And, I like to be free, and you need to rest, and I think that's what I'm going to do this time, is not really be trying to be up and on the move or whatever. I'm going to be trying to be in the bed, so like I said, the Chucks are my mommy diapers. I'm going to be using those. So what else? They gave me a bag in my birth kit for the placenta when it finally does detach itself from the baby. That is my bag, but you can use any Ziploc bag, and you should double bag it, most likely. And you can stick it in your freezer, or you could bury it with a tree. You could eat it. You could do all types of things with your placenta. It's up to you. In the hospital, they don't really give you the option of what to do with your placenta. And I think that's unfair, because, if you want to experiment with yourself, more power to you. It's yours. You could do whatever you want. I mean, that's just my opinion. So, we have scissors. These scissors cost $6 at a medical supply store, and they're the kind with the bend in them, perfect for cutting cords, so I've been told. And yeah, even though these scissors are brand new, I'm gonna have to put them in a pot of boiling water, probably once my labor starts or once my water breaks or something to that effect, so that they're ready to cut the cord if that's what I decide to do. You know, you want to have your options. So you're going to need your own pair of scissors or a household knife or a household pair of scissors. It doesn't matter. Just make sure you sterilize it before you do whatever you're going to do, which is boil it in extremely hot water for a while before you use it. So they gave me also this little disposable apron, I guess. It says full size waterproof protection from neck to knee. Okay, well, we didn't use any aprons last time. We didn't use any rubber gloves. It was mommy and daddy touching their newborn baby, and we didn't feel the need. But this little plastic thing could come in handy for all types of stuff. Maybe you could put it under your bottom or on your bed. And actually getting a plastic sheet really might come in handy, because I had my bed all nice and made up and perfect, and then I laid down and my water broke on it and I had to change the bed. So keep that in mind. So then what else came in my birth kit? Some more paper towels, wasted paper in my opinion. A really big paper towel. More wasted paper in my opinion. And another really big paper towel. Wasted paper in my opinion. So, what am I forgetting? There are things that they do to the baby after, like give it a vitamin K shot. And I had a comment about a woman whose baby transitioned because of a rare vitamin K deficiency. And these are issues, and these are those emergency things that do happen, unfortunately. And I would not want anybody to risk their baby's life or have such a loss. But if you take liquid chlorophyll, maybe in the last couple months of your pregnancy, the whole time of your pregnancy, liquid chlorophyll has a really high vitamin K content, and it will do the same as a vitamin K shot, only it'll do it internally, and you will do well and the baby will do well with the vitamin K. Also, I've been eating nori. Nori, regular seaweed wraps like you get on sushi. I had like 3 packs of that stuff, and this is even before I really realized that seaweed was high in vitamin K, but my body was just like craving it, and it was a nice snack, and I just been over like the last 2 months just tearing that nori up. And a pack of 50 wraps actually lasts a long time, longer than you think, so you might want to get that. Or alfalfa tea, also is very high in vitamin K. Your baby doesn't need eye drops, in my opinion. Your baby doesn't need a hepatitis B shot unless it's going to be coming into contact with somebody's feces or blood, and I just doubt that. And so my time is running out, but the next video will be after the birth, and it will be about what to do with, how to cut the cord, what to do with the cord, the placenta, all those things that they don't show you. So bliss to you, peace and love. Thank you for watching, and I will see you next time.